project for which myself and my team won the NHS Wales Award in 2024 was for expanding non-cancer supportive care over a period of 18 months in order to address palliative care referral barriers, improving patient experience and reducing the amount of time that these patients spend in hospital in the year preceding the end of life. Cancer patients would on average have about 80 to 90% of them having palliative care expertise in their last 1 to 2 years of life. It can be as low as 20% for non-cancer patients, and we sought to redress this inequity. We plan to make sure that equitable access to palliative care input is available across the board whenever patients have periods of destabilisation or deterioration, so that we can help patients to spend less time in hospital in their last year of life when this is often their wish, and also to support patients who would prefer to die at home rather than in hospital whenever this is appropriate and possible. And that project over 5 years has been extremely successful in terms of value-based outcomes, both in patient experience and in cost efficacy. So we wanted to expand this approach to other non-cancer conditions, including advanced renal disease, advanced liver disease and interstitial lung disease. It's very difficult with non-cancer patients to be certain when these people are going to be getting close to end of life because they have a very bumpy trajectory. And so by seeing the patients earlier, we can work together with the referring speciality, and if one of those bumps does turn into an end of life phase, then we already know the patient, we're already involved, and it's much easier to seamlessly move into palliative and end of life care if we need to. Our referrers, when we surveyed them, told us that this is a very satisfying approach for them. They find this a much easier way to work with us, and 93% of them said that they're referring patients to us that they would not have referred to palliative care in the past. So we've successfully overcome the referral barriers by this different approach. The 3 new non-cancer patient groups have also been able to demonstrate other good value-based outcomes, including a reduction in bed days in the last year of life. We've taken this value-based data as an opportunity to underpin a new strategic plan in Cardiff and Vale, and this seeks to overhaul the whole of palliative, supportive and end-of-life care for patients regardless of diagnosis, cancer or non-cancer. We're going to build further on the success of the supportive care service. We're going to take on some new non-cancer conditions, new streams, and again hoping to show the same value-based outcomes in patient experience and efficacy of the service. Once we've brought the new Cardiff and Vale palliative strategy to life and demonstrated the outcomes that we plan to achieve with that, which will again be value-based outcomes, then we will be looking to share our data with other health boards to help support them in creating business cases, and hopefully that they can also secure funding to look at further improvements in end-of-life care in other areas of Wales. For other teams who might be wanting to bring in change and service improvement in the NHS, the advice I'd give is, first of all, just to understand that change is difficult. Anywhere in life, change is difficult. And in the NHS, where all of us who work here are doing so because we want to deliver better care to patients, everybody is motivated by that, but it does mean that change can be difficult. You know, often people will say, well, we've always done things this way, and you're trying to say, yeah, but we think it could be done a better way. And that's challenging for people, for humans. The most important thing probably of all is persistence. You've got to keep on going. But ultimately, when you actually have a success in a project or more than one project, and you know that you're improving care for patients, that's hugely motivating, because that's why we're all here.